Ultra Mide 25 lotion is used as a moisturizer to treat or prevent dry, rough, scaly, itchy skin and minor skin irritations such as diaper rash and skin burns from radiation therapy. It contains emollients, which are substances that soften and moisturize the skin and decrease itching and flaking. Some products in Ultra Mide 25 lotion, such as zinc oxide and white petrolatum, are used mostly to protect the skin against irritation, such as from wetness. Dry skin is caused by a loss of water in the upper layer of the skin. Emollients/moisturizers like Ultra Mide 25 lotion work by forming an oily layer on the top of the skin that traps water in the skin. This lotion contains common emollients such as petrolatum, lanolin, mineral oil, and dimethicone. It also contains humectants like glycerin, lecithin, and propylene glycol, which draw water into the outer layer of the skin. Ultra Mide 25 lotion also contains ingredients that soften the horny substance, keratin, that holds the top layer of skin cells together, including urea, alpha-hydroxy acids such as lactic/citric/glycolic acid, and allantoin. This helps the dead skin cells fall off, keeps the skin in more water, and leaves the skin feeling smoother and softer. It is recommended to apply Ultra Mide 25 lotion as needed to the affected areas for best results. It's important to use Ultra Mide 25 lotion as directed. Some products may need to be primed before use, so be sure to follow all directions on the product package. If you have any questions, it's best to ask your doctor or pharmacist for guidance. Some products may need to be shaken well before use, so check the label to see if this applies to your lotion. You can apply the lotion to the affected areas of your skin as needed or as directed on the label or by your doctor. The frequency of application will depend on the product and your skin condition. For dry hands, you may need to apply the lotion every time you wash your hands, throughout the day. If you're using this product for diaper rash, make sure to clean the diaper area well before use and allow it to dry before applying the lotion. And if you're using it to help treat radiation skin burns, make sure to check with radiation personnel to see if it can be applied before radiation therapy. Make sure to follow all the directions on the label for proper use and only apply it to the skin. Avoid sensitive areas like your eyes, inside your mouth/nose, and the vaginal/groin area, unless directed otherwise by the label or your doctor. Also, be sure to check the label for any specific areas or types of skin where you should not apply the lotion, and consult your doctor or pharmacist for more details. Using this lotion regularly will help you get the most benefit from it. It's best to apply the lotion after bathing or showering while the skin is still damp, as most moisturizers need water to work well. For very dry skin, your doctor may instruct you to soak the area before using the lotion. And be aware that long, hot, or frequent bathing/washing can worsen dry skin. If your condition lasts or gets worse, or if you think you may have a serious medical problem, it's important to seek medical help right away. Some common side effects of Ultra Mide 25 lotion may include burning, stinging, redness, or irritation. If these effects persist or worsen, it is important to consult your doctor or pharmacist. It's important to note that if your doctor has prescribed this medication, they have determined that the benefits outweigh the potential risks. Many people using this lotion do not experience serious side effects. However, it is important to seek medical attention if you experience any unusual changes in the skin, signs of skin infection, or symptoms of a serious allergic reaction such as rash, itching, swelling, severe dizziness, or trouble breathing. It's also important to remember that this is not a complete list of possible side effects, so if you notice any other effects, it is best to contact your doctor or pharmacist for further guidance. Before using Ultra Mide 25 lotion, make sure to let your doctor or pharmacist know if you have any allergies to the ingredients in the product or if you have any other allergies. This product may contain inactive ingredients that could cause allergic reactions or other problems. If you have skin cuts, infections, or sores, be sure to consult your doctor or pharmacist before using this product. Some ingredients in the lotion, like preservatives or fragrance, can make you more sensitive to the sun. Be sure to check the label for any warnings or ask your doctor or pharmacist if you need to take any special precautions when in the sun. It's important to limit your time in the sun, avoid tanning booths and sun lamps, and use sunscreen and wear protective clothing when outdoors. If you get sunburned or have skin blisters or redness, be sure to tell your doctor right away. Some products may make acne worse, so if your skin is prone to breakouts, look for the word non-comedogenic on the label. And some products may stain or discolor clothing, so ask your doctor or pharmacist for more details. Before having surgery, it's important to let your doctor or dentist know about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, be sure to tell your doctor before using this product. And if you are applying this product to the breast area, consult your doctor before breastfeeding, because it is unknown if this product passes into breast milk. It's important to be aware that Ultra Mide 25 lotion may interact with other medications, which could affect how they work or increase the risk of serious side effects. It's important to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. This can help ensure the safe and effective use of Ultra Mide 25 lotion and any other medications you may be taking. If Ultra Mide 25 lotion is ingested, it can be harmful. If an overdose occurs and the individual experiences severe symptoms such as fainting or difficulty breathing, it is important to seek immediate medical attention by calling 911 or a poison control center. In the U.S., residents can contact their local poison control center at 1-800-222-1222, while Canadian residents can reach out to a provincial poison control center. To prevent dry skin, it's best to use lukewarm water when bathing, and try to limit baths or showers to every 1 to 2 days. Keeping showers short and using a humidifier when the air is dry can also help. Ultra Mide 25 lotion is an emollient product that comes in the form of a lotion. It helps to keep the skin moisturized and can be used as recommended by your doctor or pharmacist. If you forget to use Ultra Mide 25 lotion on your regular schedule, use it as soon as you remember. But do not use extra lotion or use it more frequently than directed to make up for the missed dose. Make sure to check the storage information on the package and ask your pharmacist if you have any questions. Keep all medications out of reach from children and pets. Avoid storing the foam canister near high heat or open flames, as well as puncturing or burning the canister due to its pressure. Do not flush medications down the toilet or pour them into a drain unless specifically instructed. When the product is expired or no longer needed, make sure to properly discard it. Your pharmacist or local waste disposal company can provide further guidance on how to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.